This is Samantha Nussdorf doing her assessment on Scott O'Connell. Scott, is it okay if we do an assessment?
Yes.
Okay, I'm going to go wash my hands. Alright, first we're going to start with looking at the overall skin tone. Everything's looking normal color. No jaundice noted. Now we're going to do a scalp palpation, make sure there's an even hair distribution. Okay. Everything looks good there. Now I want you to wrinkle your forehead. I want you to puff out your cheeks. Clench your jaw. Open and clench. Clench like that, okay? Now I want you to try to close your eyes. Now try. Okay, great. Okay, now I'm going to have you open your jaw, close it. I want you to move it side to side. Okay, now I want you to try to keep your mouth closed and open it. Okay, good. Now we're going to palpate the sinuses. We're going to do the frontal sinuses and the maxillary sinuses. Alright, everything looks good on that. Alright, now we're going to do the vision test. Since we can't perform the Snellen test, what a Snellen test is, you have your patient stand 20 feet away and read the line. Everybody to have perfect vision would be 20/20 vision. If anything less, it can go up, be 20 in one eye and 60 in another. And now we're going to do the kinetic confrontation test. So I'm going to sit in front of my patient. Okay, I'm going to have you block one eye. We want to make sure you see my fingers. Look at me.
Yep.
Okay. You see my fingers?
Yes.
Okay, now other eye. You see my fingers?
Yes.
See my fingers?
Yes.
See my fingers?
Yes.
Okay, great. And then next, where's my... Now we're going to do the extraocular movement, so I want you to follow my finger. We're going to do the 6 fields. Okay. And that is good. And then next, we will be testing the corneal light reflex. So what I'm going to do is keep the light a couple feet away and have the patient look at me and ensure that there's the flash is reflecting in both of his pupils, which is good. And now we're going to inspect the cornea and the sclera. No jaundice noted. No excess redness. Mucous membranes are moist. And now we're going to check the pearl and make sure the pupils are equal and reactive to light. Look at me. Okay. They're equal and reactive to light. Okay. Now we're going to look at the ears. We look at the position, which they are even. The alignment's good. We're going to inspect the external auditory canal, which is good. Both sides. And now I'm going to palpate the trays. Let me know if you have any tenderness when I touch.
No.
Okay. Any tenderness?
No.
Okay, now we're going to do the whisper test. I want you to block that ear for me, and then I'm going to whisper something to you, and I want you to tell me what you hear.
1, 2, 3.
Okay, and now with the other ear.
A, B, C.
Okay, great. Okay. Alright, now we're going to do your mouth. Okay, so I'm going to inspect the buccal mucosa, so open your mouth for me. Okay, I'm going to look around there. Other side, I want you to look under your tongue. Okay, stick your tongue out for me. I'm going to look on the sides of each tongue. Other one. Okay, now I'm going to stick your tongue out and go, Look in the throat. Okay, looks good there. Now we're going to have patients stick the tongue out, look for symmetry. And no bad odor noted. Now we're going to check the nostrils. So do this again. You look up for me. We're going to look. Everything looks good. No redness. Now I want you to block one nostril and blow out of the other. Okay, for checking for patency in each nostril. That's good. Okay. And now, since we're not going to actually test the gag reflex, what we would do is use a tongue depressor and push down on the tongue and wait for the gag reflex. And now we're going to move on to the neck. We're going to inspect for any lumps, extra palpitations. None are noted. Looks symmetrical on each side. Now I want you to bend your neck forward, back, and side to side with each shoulder. Okay, and then we're going to palpate the lymph nodes. I'm going to start behind the ears here. Note any swelling. Okay, that looks good. And now we're going to palpate each carotid artery one at a time. Okay, that looks good. On this side. Okay, that looks good. Alright, now we're going to palpate the trachea, check for alignment, make sure it is not deviated. Okay, everything looks good there. Now I want you to, with resistance, I'm going to push on you. I want you to move your hip forward. Okay, back. And do a shoulder shrug for me. Okay, everything looks good there. Now we're going to palpate the thyroid. Okay, I want you to, from behind, I want you to swallow for me. Okay, good. Okay. So now we're going to move to the back of the posterior of the chest, where you're going to take a look at the thoracic cage, make sure for symmetry. The muscles are all developed correctly. Everything looks good here. I'm going to palpate the vertebrae, make sure it's aligned and the vertebrae is palpable. Next, we're going to listen to lung sounds in the 5 aspects. So I want you to take some deep breaths for me. Next, we're going to check the CVA. Let me know when I hit you if you feel any tenderness. So we need a small tap.
No. No. No.
Next, the other side.
No. No. No.
Okay. Alright, now we're going to move to the interior of the chest. We're going to look at the front. Face it forward for me like this. You take a deep breath. We're going to feel for make sure everything is even. Okay, move that out. And then next we are going to listen to the breath sounds at the 5 levels and compare each side. Okay, take some more deep breaths for me. And then next we're going to check for any murmurs. I'm going to put it on the base of the heart. I'm going to have you lean forward and exhale. Okay, you can sit back up. Okay. Now we're going to take a look at the hands. You go like this for me. Skin looks good. Okay, no clubbing in the fingernails noted. Skin is warm and dry. Good skin turgor bilaterally. Capillary refill is less than 3 seconds. Okay, that's good. And you just look in the palm of your hands. Okay, that's good. Now we're going to check out your wrist. Let me know if you have any tenderness. I'm going to just touch your wrist here. Any tenderness? Any tenderness?
No.
Okay. The other wrist?
No.
Any tenderness? Now we're going to check your range of motion. You go side, side, up, down. Okay, that's good. And I want you to do this. All right, now we're gonna do your shoulders. So I want you to go out, all the way up to your sides. You go forward and back. Okay, that's good. Okay, now we're gonna do your arms. I want you to go like this for me. You to push against me there. Okay, great. Roll back in there. Okay, good strength on both sides. Okay, now for your hands. I want you to put your hands out. I want you to spread your fingers. Hands down, up. I want you to touch your fingers, the base of each finger to your thumb. Okay, that's good. And then, now we're going to do with the wrist when you put your hands up and push against me. Okay, push back. Okay, great. Now we're going to inspect the neck, where you're going to have the patient lie down. So you could lay down there. We're at a 45-degree angle. We're going to inspect the any venous distension in the neck, and that is noted there. Okay, and now we're going to check the pericardium for any pulsations and heave. So we're going to feel here. There's no heave or pulsations noted. Pulse is unable to palpate. Okay, that's good. Okay, and then we're going to just palpate the anterior chest, note any thrill, and if the apical pulse is palpable. Okay, there. Good. We're going to listen to the S1, S2, and the 5 cardiac levels. And now we're going to do it with the fellow of the scope. And we're going to listen to the apical pulse for 15 minutes. Okay, and that's good. Alright, and now I'm going to have you lean to your left side, and I'm going to listen at the apex of the heart. Okay, that all sounds good. Alright, now we're going to go to the abdomen, look for skin patches, any in the ambulance, make sure that everything looks good. Everything looks good there. So now we're going to listen to the 4 quadrants in the bowels. So we're going to start with the right lower quadrant, move up. Okay, we've got positive vowel sounds in all 4 quadrants. And now we're going to actually listen to the aorta with the bell of the scope as well. Alright, that is good. Now we're going to progress the 4 quadrants in a zigzag pattern. Okay, now we're going to palpate the abdomen in all 4 quadrants. Let me know if you have any tenderness. Do a soft palpate.
No.
Tenderness.
Okay.
That's good. Now we're going to test the range of motion of the legs. So I want you to move your left leg out for me. Cross over. I want you to up. Then bend the knee into the chest. Then over and outside. And now with the other leg. Move out. Cross. Up. Bend the knee. Then outside. And cross over. Okay, that looks good. You can lay your leg flat there. Okay, now we're going to check for any edema and the temperature. There's no edema noted in the lower extremities. Skin is dry and warm, no coolness to touch. And that looks good. And now we are going to test the ankles. I'm going to have you point your toes down, up, and in, and outside. Okay, we have full range of motion there. And then next we are going to separate and inspect the toes and check the capillary refill bilaterally. So we're inspecting in between the toes on both feet. Okay, that's good. We're going to check the cap refill both sides. Less than 3 seconds on the left. Less than 3 seconds on the right. So that one looks good. And now we are going to test the... Next we are going to test the strength. And now I'm going to have you push up. Okay. Up. That's good. Alright, now next we are going to, the skin looks good, hair distribution is even. Now we are going to palpate the pulses in the legs. We're first going to do the popliteal behind the knee on both sides. Make sure that's palpable. Okay, that's good. And now we're going to check the posterior tibial on both sides. Okay, that's good. And then the dorsus medialis on the foot. Okay, that's good. Come. Okay. Very good. Okay. And now I'm gonna have you run your heel across your shin on both sides. Okay, that's good. And then next we are going to do the Babinski reflex. So what I'm going to do is run my nail down the bottom of his foot and check for his toes to fan out. Okay, we're going to start at the heel and move up. Okay, we're going to fan out. Okay, that's good on both sides there. And then next we are going to move on to the musculoskeletal neuro. So now we are going to have the patient sit up again for me. Okay. Okay. And then we're going to check the strength of the knees. So I want you to push out. Okay. And then I want you to push back in. Push out. Push back in. Okay. And next we're going to do the patellar reflex. This is here. This is patella. Okay, that's good. Okay, that's good. Alright, and now we're going to do the light sensation test. I'm going to use this cotton ball here. Let me know if you can feel this.
Yes.
Okay.
Yes.
Okay. Forearms.
Yes. Yes.
Mm-hmm.
Yes. 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 Yes.
Okay, good. Alright. So next we're going to do the strychnosis test. I'm going to put something, I want you to close your eyes for me. I'm going to put something in your hand and I want you to tell me what it is.
It's a bobbing pin.
Yeah. Okay, and then next, I'm going to have you close your eyes. And I'm going to move your finger. I want you to tell me if I'm moving it up or down. Okay?
Move your finger up, up,
Okay.
down, down, up, down, up.
Okay, and that's good. Now I want you to, I'm going to have you take your hands and go back and forth real fast. Make sure that all works good. Okay, good. So I'm going to have you stand up. And what I want you to do, I want you to walk across the room for me. Okay, you can stop there. And I want you to walk back on your heels. Okay, and then I want you to go back on your toes. Okay, and then next I want you to do heel to toe. Okay, great. Now I want you to stand here. We're going to do the Romberg sign next. I want you to stand with your feet together, hands to the side. And we're going to look for any wobbling, which there's none noted. Now I want you to close your eyes. We're going to look once again. No wobbling noted there. Okay, and then next I want you to, I'm going to check the motion. I want you to bend forward for me. Okay, bend back. Side. Okay, other side. And then twist. Okay, that's good. And then next we're going to do the shallow knee bend. So I'm going to stand next to the patient to make sure he doesn't fall. I want you to bend one knee and then bend with the knee. Okay, and now opposite side. Okay, great. So that's it for my assessment today. Thank you, Scott, for letting me assess you. Have any questions?
No, thank you,
All
Samantha.
right, we are all set. Thank you.